In this video, I'm going to show you how to quickly and easily document the orthopedic neurologic exam on a new patient. So for documenting the OrthoNeuro exam, you want to make sure that you document both the positive and the negative findings. Some doctors make the mistake of only documenting the positive findings, but us reviewers, when we see that there was nothing mentioned about a test, that tells us that it wasn't performed. You don't want to get into that trap. So make sure that you document, even if you did the test and it was negative, you do that. Now remember, for a lot of the orthopedic and neurologic exam that we'll do on our non-radicular patients, which for most chiropractors makes up the vast majority of our musculoskeletal patients, that OrthoNeuro exam is going to be largely negative, and that's okay. So we want to be certain that we can document that in the proper way. So you log into the program with your username and password. In this case, we're going to go back to our patient Mickey Mouse, click on the date that we stopped off on, and then we're going to click the date on the right and resume visit.
So now I'll click on Evaluation and Management. And you see I've got some vital signs separate from the OrthoNeuro exam in case you like to do certain vital signs on typical visits without a whole exam. For example, I like to do pulse rate and pulse ox on pretty much every visit these days. So let's say pulse rate was 68, pulse ox 99. That's just optional. OrthoNeuro exam, I'll click on that. And if this is a new patient or established patient, we just want to document if we're going to base this on either time or medical decision making. And basically, if the patient had a history of some kind of trauma and you document that, I would say document for medical decision making. If they just woke up with discomfort, then I would say use time. So let's just make this easy and say medical decision making, and it's a new patient. All right, and I'll select the code, and it's just almost always, if they have some kind of trauma, it'll almost always be automatically a 99203 for that. And then we want to come down and see what did we do in the exam. So this includes visual range of motion, noting pain, manual muscle test, deep tendon reflexes, dermatomes, orthopedic test, palpation, or anything else that you might choose to do. If you did all these things, just check the box that says all. If you did not do all these things, then just check the individual boxes of what you did. Keep in mind, though, that the visual assessment of range of motion and palpation findings, that is going to be documented on the part page. So on this page, it's only going to be the orthopedic neurologic tests.
Let's say cervical spine ortho. Just check off the test that you did, and I have the program automatically defaulting to negative. Okay, if it was positive, just go ahead and click on positive, and sometimes it'll ask you for some different questions in there. For dermatomes, I have it defaulting, so it starts off at normal. If they were normal upper extremities, all normal, just click on all for normal. If they were increase or decrease, you would click on the increase or decrease buttons and then check off the boxes of the ones that were increase or decrease, and left, right, bilateral, and so on. So in this case, we'll just do normal for all. Deep tendon reflexes, I defaulted to normal for the upper extremities. If it's abnormal, then go ahead and click on abnormal. Then you would check off those boxes as well. For upper extremity muscle strength, if you did all the muscle testing that are listed here, just click on all. And then this defaults to grade 5 normal bilaterally. If you didn't do some of those, just unclick the box of the shoulder or of the particular area that you did not do. If it was not grade 5, just check on that one and say what grade it was on the left side or right side. If you did lumbar spine exam, same idea, just check off the tests that you did. It defaults to negative. If it was positive, you want to make sure that you answer whatever questions pop up in there. So this way we can document both positive and negative findings. If you do dermatomes, check on that. It defaults, you could hit normal. if they were all normal. If not, just click on the ones that were increased or decreased. Reflexes, same idea, defaults to normal. Lower extremity muscle strength, if you did all of them, just click on that, it goes to grade 5. And if any of those were not grade 5, just check on the ones and click on what grade it was. I do like to document when that exam showed no contraindications to beginning chiropractic care. I do like to say in my notes that there were no contraindications to beginning chiropractic care. So just click on that box as well. That's all you need. So if you have any questions about that, just feel free and email me at Dr. Greg, spelled with 2 G's at the end of Greg, at thebulletproofchiro.com.